welcome to the Art of Being Human. I just want to mention a couple of things about the opioids because we're having a terrible time, people being addicted to them. And I didn't have a chance to mention too much about it in the last segment, but you have as the opioids oxycodone and hydrocodone. Oxycodone is a painkiller. It's the most popular of the painkillers, but hydrocodone is also a painkiller. They're all addictive, and you have to be careful how you use them because they're addictive. A lot of people get addicted to it. Hydrocodone sometimes will have acetaminophen in it. Now, I was told by a nurse, I've also told by a doctor, I've also heard it on television by medical professionals that you can get the same, and I'm not suggesting you do this. I want you to understand I'm not your doctor and I'm not trying to get you to do something, but I was told that if you take ibuprofen and take acetaminophen, which would be Tylenol, at the same time, that you get the same benefits in painkiller as you would if you were taking those opioids. Now, I've never tried it, I don't know. But I know that I had a terrible, terrible flu, sore throat illness maybe a couple of weeks ago. And one of the nurses in the urgent care told me, because they couldn't give me an antibiotic because it was a virus, and viruses don't respond well to antibiotics, and it's an overuse of antibiotics. So what she says is, you know, you can take so many, I'm not going to tell you how many, because I don't want anyone really to try it without medical supervision, but you can take so many ibuprofen and then wait a while and add a couple of Tylenol, and it actually boosts the effect, the pain-killing effect of the ibuprofen. Now, as I say, I've never tried it. If you're interested, if you're having a lot of pain, and if you want to stay away from the opioids, which is always a good idea if you can, then you should talk to somebody about it, because it is a medical fact. I guess I've heard it from nurses, I've heard it from doctors, it's been told to me personally, I've seen it on TV, so there's got to be something to it. But just remember, those opioids are really difficult to get off from once you're hooked on them. And they do give you liver failure and other illnesses. Now, I want to get on to heroin. How do you know? What are the symptoms of a person that's using heroin? Heroin is a hard drug. We'll be getting more into the hard drugs as I go along in this class. But this is the kind of signs of use of a person who is addicted to heroin. They nod off. There's a lack of energy. They have slow, slurred speech. Their appearance changes. They're not clean. They have shallow breathing, dry mouth. They're constricted small pupils. The pupils are not the normal size. They spend more time sleeping. They have poor schoolwork if they're in school. They have no motivation. They're apathetic. They have no goals. In other words, they can just sit there and life goes by. They don't have any goals. They're not excited about anything. They don't want to do anything. They're just like there. They withdraw from friends. They have a loss of interest in hobbies. They steal and borrow money to continue their addiction. This is a case of where a person may have started using heroin thinking it would help them in some kind of a way, make them feel better, maybe even self-medicate for something, and then they got too much, because you're always going to get too much. You're going to get addicted to it. It is a very addictive drug. And so when that happens, the brain takes over and you cannot do anything without that drug. Your whole life is based upon when you get the next fix, because that's what you want. Your brain is demanding it. Your brain chemistry has actually changed. By this point, you've gone from wanting it to needing it and demanding it. And so therefore, you just have to have that drug, and you'll just give up everything. You'll give up your friends. You'll commit crimes. You'll do anything to get the fix. Why? Because it's not pleasurable anymore, and you're taking it so you don't have withdrawal symptoms, because the withdrawal symptoms are very, very difficult, very hard to go through them. And yet people can lick it. People can get by, but usually not without help. Usually it takes about 5 or 6 attempts at rehab before it finally kind of clicks in, because they go back to the drug. The desire for the drug is so strong that they keep on going back to it. You know, marriages break up, children don't see their parents, the money is used for drugs and not medical care or not food or anything like that. Rent goes unpaid, people are homeless, all because of the effects of a drug that's taken over the brain. So it's very important to stay away. I can't tell people what to do. I'm not in that position, neither do I want to be in that position. But what I can do is tell you what happens if you do it. You know, I've worked with teenagers and I've worked with students, and I had someone come to me and said that their son was on LSD or wanted to take LSD or wanted to take drugs, and she was hoping, and I usually just worked with college kids because I was a college professor and this boy was younger than that. But I told her I would do what I could to get him off drugs. And what I did was I didn't tell him not to use them. The first thing I did, I said, don't be surprised at anything that comes out of my mouth. There'll be a purpose in everything I say. So I approached this young man and I said, you know, I can't tell you not to take drugs. Now, if I said don't take the drugs, he would probably say, oh yeah? You and whose army is going to tell me what to do? You know? So in a sense, what I do is I agree with them right away. I can't tell you not to take drugs, but what I can do is give you information as to what's going to happen to you if you do use drugs. And then you have to make your own decision. But even if you make your decision, which could be right or a wrong decision, then you have to understand that you have to bear the consequences of that decision. If you're old enough to make a decision to do something which is not in your best interest, then you have to make the decision that you're going to take the consequences that go with that. If it means going to jail because you've committed a crime, so be it. If it means that you have medical problems as a result of it and you require treatment, that's just the way it is. You can make the right decision and not go through all that. But I went and I told him, and I got out some textbooks. He was interested, I think, in LSD. So I got out some textbooks, and what LSD does is it mimics the nervous system and how the nervous system responds to stimuli. So it's like the brain is being tricked into sending out impulses which are hallucinatory. They're not true hallucinations, but they're hallucinatory drugs. And so I showed him pictures, and I showed him this is what your brain looks like, and these are what the cells are like, and this is what happens when you take this drug, and this is what it does to these cells in the brain. I gave him as much scary information as I could dig up, and there's a lot of scary information out there. So that he would know if he did make that decision that he was putting himself in danger. But I never told him not to take him. It's your choice, but at least if you make a choice, know what you're getting into. Give me the chance to tell you what it's like and what's going to happen. And then you can make your decision based upon knowledge. Who wants to make a decision and not have the knowledge to do it? So this is the way I approached it. And I spent a good deal of time with him, and he decided he wasn't going to use drugs. The risk was just too great. So before he actually became very, very involved in the drugs, we took him off. And I've done that before with other kids. You've got to remember that teenagers, they're wonderful in a lot of ways, but their brains are not completely mature. A teenage brain is not going to be mature until about age 25. So I know 14-year-olds think of themselves as very mature. I felt that I was very mature as a 14-year-old. I can even remember thinking, boy, I'm as mature as I'm ever going to get. I was about 14 at the time. And of course, all teenagers think that. It's not true, of course, but all teenagers think that. And what they don't realize that at age 14, they've still got a good 10 years of brain development left before their brains are fully mature. Why do teenagers make bad decisions? Well, sometimes they just can't think far enough ahead as to the consequences of decisions because the brain isn't quite there yet. It's like it's growing in that direction, but they can't have full understanding of decisions that they make and the consequences when they're only 14 or 15. This is where parents step in. This is where parents instruct. You can't do this because this is what might happen to you. Teenagers don't think that far ahead because their brains aren't developed. It's not that there's anything wrong with them. It's their stage of development and their stage of maturity isn't such that they can look at things from an adult perspective because their brains haven't developed far enough to be able to do that yet. And when they get there, then they'll look back and say, what was I thinking? Well, a teenage brain thinks wonderful thoughts, but at the same time, they can't be fully mature because the brain isn't fully mature. And so before people go running around and say, these stupid teenagers, they should stop to think. They were teenagers once themselves, and they probably did the same kind of thing. But this is the mistake of the teenager is to think that they're fully mature. They need to realize that they're not thinking sometimes as mature as they will later on because the brain hasn't developed enough for that. Okay, now what are the items used to take heroin or to take drugs? Usually it can be taken with syringes, with needles, burned silver spoons, aluminum foil, gum wrappers with burn marks, missing shoelaces which tie off injection sites, straws with burn marks, small plastic pipes, white powdery residue, water pipes, and other pipes. You know, there are different ways in which drugs get into the system. But the problem is it goes downhill and downhill and downhill. What seems like an experiment that I can surely stop anytime I want to becomes a helpless cry for help because they can't stop. Once they're addicted, you can't stop. You have to go through a process of being able to be weaned off drugs. And sometimes cold turkey. One woman said, you know, and she was trying to get off cold turkey from the drugs. She said, you know, at first with the withdrawal symptoms, I was afraid that I was going to die. And then I was afraid I wasn't going to die because the symptoms were so severe. Now, there are psychological issues, and there are psychological words that we use to describe people and what they are like and how they respond to drugs. And what I want to go through now is some of these terms, they're medical terms that we use when we're dealing with people who have addictions or people who have personality disorders that would lead them maybe to become more able to become addicted, you know, weak egos and all of that kind of thing. And you hear these terms when doctors and professionals talk about drugs and drug addiction, so I want to go over some of these terms, and so you'll understand them if you are hearing them. First of all, a definition for a weak ego. I don't know if that's used so much now as it used to be, but it just means that the person doesn't have a strong character. You know, a lot of people can't say no. They think they've got to say yes to everything. You almost have to teach a child how to say no. If somebody touches you in an inappropriate place, say no. Don't think you have to do what somebody asked you to do just because they asked you to do it, because if you don't, they don't like you, or you're not nice enough, or something like that. What children get entrapped in is wanting to be liked and wanting people to like them. And to the point where if they're asked to do something, they just do it because they want a friend. They'd rather be liked than have any criticism because, well, you didn't do as I asked you to. You have to teach children how to set boundaries. There are some people who have very great difficulty in setting boundaries, and no doesn't mean much to them. They want to do what they want to do, and they want to get friendships from people, and they want people to like them, so go with me and let's let's rob the store, okay. And this is where teenagers have problems too, because it's harder for them to set boundaries because their brains of the brain development. It's harder for them to do that. So teach your children to say no. Emotional liability or lability just means a quick change in emotions. You know, they're happy one moment, they're sad another moment, they're laughing one moment, 2 minutes later they're crying. If you see a person who's like that, there are certain emotional conditions that are like that, and if you're seeing somebody for counseling like that, they will sit in your office and they'll be laughing and happy and suddenly start crying about something. And it's kind of hard to keep up with what the changes are that they are experiencing. But this is what you have to do to understand them and to help them. So this lability is quick changes of emotions. Malaise just simply means not feeling well. Dysphoria means not feeling well, but also being unhappy, having an unpleasant mood, depression, anxiety, restlessness. That's dysphoria. Euphoria is well-being, not realistic to the situation. If a person feels euphoric, they feel very high, very happy, very giddy, and yet it may not be a realistic emotion in terms of the situation that they are in. But that's euphoria. Now, somnolence, S-O-M-N-O-L-E-N-C-E, means being drowsy. And drugs, of course, would make a person drowsy. Nystagmus, and it's spelled N-Y-S-T-A-G-M-U-S, a rapid involuntary movement of the eyes, and sometimes with dizziness, and the eyes oscillate back and forth. Drugs will do that. Drugs will do that. Tachycardia, I'm going to spell it for you, T-A-C-H-Y-C-A-R-D-I-A. Tachycardia is a rapid heartbeat, and it's due to drugs, sometimes due to anxiety, sometimes due to other medical problems, but tachycardia is an abnormal rapid heartbeat. Grandiosity means unrealistic feeling of greatness. I'm the best. I'm better than anybody else. I can do that so much better than so-and-so can do it. I should be chosen. It's like an egotistic kind of personality where we think that we are, whoever has it, think that they're better than anybody else. So that's grandiosity. Hypervigilance. Now, hypervigilance means a heightened searching around, watching everything just to make sure something bad doesn't happen, just watching and seeing what people do. I know one of my friends who used to use an ATM a lot. She'd look around, is anyone watching me? You know, as she's putting in her card so she won't have identity theft and all of that. But that's hypervigilance. It's heightened alertness, scanning the environment and watching for danger. And that's what that word means. Psychomotor agitation. Now, psychomotor agitation is a tense, restless, overactive, wringing of your hands, pacing, anxiety. This is what it means, psychomotor agitation. And it affects the way you move, it affects the way you think, and you're just uptight, not feeling good. And let me see, arrhythmia is an abnormal change in the heartbeat, and the beats are not regular. And then you have hallucinations. The drugs will give hallucinations. Some of the drugs are hallucinogenic experiences. And what a hallucinogenic, the difference between hallucinogenic and a hallucination is a hallucination is coming from your own body chemistry. If a person is mentally ill and their neurotransmitters aren't working right and the brain chemistry is not in balance, they will sometimes have hallucinations in which they're seeing things that are not there, or delusions where they're believing things that are not true, or auditory hallucinations where they're hearing things that aren't there. They can hear, see hallucinations, and also have delusions where they're believing things that are not true. And drugs, especially LSD and drugs like that, will do that. They will give you hallucinogenic experiences in which the brain is getting enough of the drug that it mimics. What you're seeing mimics a real hallucination. So it's hallucinogenic. It's not a true hallucination, but it looks like it to the person who's experiencing it. It sounds like it. Everything about it is like a hallucination, but it's coming from the drug. The drug is tricking the brain into firing impulses that are causing the hallucinations, and that is different than if it just comes from your own body chemistry because something is out of balance. In mental illness, a lot of mental illness is physically caused. And when the chemistry gets into balance, such as in bipolar, then the symptoms tend to go away. But it has to be monitored all the time because what's good on one day may not be good on another day, and the needs for medication changes. So you have to monitor that. But if you're taking a drug, you get a very similar experience, but it's coming from the drug. The brain itself is being caused by the drug to give you a hallucination, which you wouldn't be doing if you weren't taking the drug. So that's hallucinogenic. It's very interesting when you get into it, what the changes are. Now, you have to be very careful as to what you put in your body. There was a woman, and I've mentioned this before, but it bears repeating. There was a woman who was taking colloidal silver, which is a liquid, and it was taken for some people as a cancer preventative. And what happened was she got too much silver in her system, and the silver lined her face. She had a covering of silver on her face, which was permanent. It settled there. There was no getting it off, and the face turned silver. In the right light, it would look bluish. And so she had trouble. Her mind was fine. She could do anything that anybody else could do. But her face was silver, and she couldn't get a job after that because people would notice that her face is different. It's silver. It's not like other people's faces. And nose drops, you have to be careful. Sometimes they contain silver. She was not sick. But she certainly couldn't behave as a couldn't live like a normal person. Now, there was a man who turned blue because he took something in his system. He was trying to prove something, and he turned actual blue. He wasn't sick, but his whole body color was blue. And, you have to be just careful. And as I mentioned before, e-cigarettes as a substitute for regular cigarettes can be dangerous because instead of getting you off smoking, they get you smoking e-cigarettes very highly. So I don't know, it's about time, I guess, where I need to close. We don't have much time left. But symptoms of poisoning, if you get drug poisoning, would be vomiting, muscle paralysis, seizures, and sometimes death. There's no such thing as a safe drug. Even an ordinary drug that you can buy anywhere, if you overdose on it, if you do something more than what you're supposed to, you can get liver failure, you can get kidney failure, and you can be in real trouble. So you have to be very, very careful of what you put into your system. And if you do use over-the-counter drugs, follow the directions explicitly. Don't go over what it says. You may think that you're going to go over and you're going to feel better, but 2 is not better than 1 if 1 is what's prescribed. You have to be careful because you can get yourself into trouble, get sick, cause organ failure, and that is not a good thing. So I'm going to close it here. We'll continue with this lessons on drugs and how to stay away from them next time. Please join me then.